Chapter 14, Mental Disorders. Treatment, protection from injury is the main issue. Minimizing their exposure to something that would disturb them at night, like scary movies and so forth. And then with adults, treat them with sleep medications. Sleepwalking persons shouldn't be interrupted or awakened. When drugs are suspected that may be causing it, and they may be found. This is like drugs usually treatment in this case, and so they might want to find another drug that treats it. Narcolepsy is daytime sleep episodes that can last a few seconds to a half hour. Usually they come on by sitting around something that is a monotonous type activity. Unfortunately, sometimes the sitting around may also include driving a vehicle. Treatment is therapeutic naps, establishing a normal night sleep pattern, and medication therapy. It usually can occur while driving, sitting in a lecture, or even eating. Known causes for apnea are obesity, hypertension, obstruction in the nasal cavity, things like deviated septum might do it. Alcohol ingestion, smoking, that may be causing some level of bronchitis. Sleep deprivation occurs more often in men than in women. And with the obesity, it's probably due to fat tissue that is an overdevelopment in the throat. Diagnosis starts with a sleep history. Onset's usually in middle age, but not exclusively. They have daytime sleepiness, sleep attacks. They snore or snort during sleeping. That's one of the key symptoms. Sleep studies will then note the apnea during the study. And these are going to require quick intervention to change the lack of oxygen because it can actually have long-term physical effect. Weight loss is a treatment, and in some cases it has been a significant benefit in a lot of patients. Taking care of things like nasal obstruction, appliances so that it feeds air into the airway, so those CPAP machines and so forth. Avoiding drugs that suppress the CNS, so things that like alcohol, nicotine, sedatives, so something that might be used to help someone sleep might also cause sleep apnea. Surgery to remove a part of the uvula and soft palate that may be obstructing. Prognosis depends on the cause. Of course, losing weight if you're overweight would be, I won't say it's an easy one, but it is a solution that you can find easily. In personality disorders, there's a pattern of behavior that is altered from what is socially acceptable. It produces ingrained maladaptive behavior. If you remember what maladaptive is, the beginning of the word maladaptive is mal, which means bad. So they are adapting badly. Symptoms discovered patterns of relating, thinking, and perceiving disordered patterns. Impaired social and occupational performance, and may come off in an extreme of personality, either arrogant or shy or blaming or something that's more extreme in personality. Typically has thoughts about themselves and the world that cause some inappropriate behavior. 10 personality disorders are characterized into three clusters. With cluster A, there's paranoid personality disorder, schizoid personality disorder, or schizotypical personality disorder. these should be assessed to distinguish from the delusional disorders and psychotic disorders. These in cluster B disorders, we have antisocial personality disorder, borderline personality disorder, histrionic disorder, and narcissistic disorder. So some of these have a disregard for or tend to violate the rights of others. And a person with borderline personality disorder has a pattern of unstable interpersonal relationships, self-image, and feelings. Cluster C is the avoidant personality disorder, dependent personality disorder, and obsessive compulsive personality disorder. The avoidant type avoids any social situation because they're afraid of being criticized or disapproved of or rejected. The dependent personality disorder tends to rely on others to make decisions and so forth, whereas the obsessive compulsive, we've kind of talked about that already. There's really no cause for personality disorder, but they do have a link to biological, social, or other types of pathways. Depends on the symptoms in treatment. Usually it includes psychotherapy, medication therapy, anti-anxieties, antidepressants, family therapy, poor prognosis overall because it is an ingrained part of their trait in their own personality. So it's the way they're used to living their life. Animal therapy. This is pet therapy and service animals. They're used for a lot of different things. They aren't, first of all, pets. They require intensive training in behavior and responding to their handler in order to assist with whatever disability they may happen to have. So examples, they may guide someone who's blind or alert someone who is deaf by nudging them or those kind of things. They can pull a wheelchair. They can alert and protect someone's having a seizure. They can remind someone with a mental illness to take their medication. And they can be calming to someone with PTSD and or anxiety. And you do see these used quite often with PTSD patients. You also see them used in hospitals where you have patients who are maybe experiencing a pretty severe medical issue and they're going to be in a hospital for a while and they may have maybe in ICU or those kind of things, or at least in very near ICU situations. And so they will bring the therapy dogs around to visit them, and it is very beneficial. This is very interesting to see.